Good morning, everyone, and thank you for joining our webinar this morning. Sorry we were running a little late. We had some technical difficulties, but my name is Caroline, and I'm the Senior Casework Manager in the District Office. I will be moderating the webinar this morning. We have a presentation from the Center for Medicaid and Medicare Services with Acting Director for the Atlanta region, Mr. Sherrod Mackey, and following his presentation, we will have a Q&A session. But before we begin, we have Congresswoman Lucy McBath here to kick us off for the event.
Thank you, Caroline, and good morning, everyone. Thank you so much for joining us this morning, and I'm very thankful that we have this opportunity to be together virtually during a time in which it's smart to do so for the health and safety of ourselves and our friends and our loved ones, and to stay home and to stay away from others until it's a safer time to do so. Before I begin today, I want to impress upon all of you how important it is that you take care of yourselves physically and mentally. It is critical that we continue to listen to the public health experts like those at the CDC and to follow all recommended guidelines. Please continue to physically distance when possible and wear a face mask in situations where keeping 6 feet of separation is difficult. I understand that I just flew in from Washington this morning, and of course, it was literally impossible to stay 6 feet away from individuals. And so, of course, we're all following CDC guidelines and wearing masks and gloves. But I do want to encourage you to take care of your mental health too. Check in on your families and your friends and your neighbors. Increased periods of isolation at this time are very difficult under the most routine circumstances. And this chapter of our history is anything but routine. I think everyone would agree. I also want to offer my ongoing condolences to those of us who are grieving for a friend or a family member who's passed away due to coronavirus. And my prayers are always with those who are grieving this day in Georgia, across America, and around the world. We are here today to learn more about what the Centers for Medicare and Medicaid Services are doing to help beneficiaries adapt to the many changes that we have experienced over the past several weeks. I know many of you have concerns about how to access your Medicare or Medicaid benefits during this time. And all federal agencies have had to adjust their operations to continue serving the American public during this very difficult time. And my office has continued to engage with our CMS partners here in Georgia to assist constituents with their casework. Today, I'm excited. I'm joined by an expert with CMS, Sherrod Mackey. Sherrod is the Acting Regional Administrator for CMS in the Atlanta Regional Office. And I want to thank Sherrod for lending his expertise to this event today and for all the work that he is doing to continue serving our constituents during these very, very difficult and uncertain times. So in just a moment, I'm going to turn things over to Sherrod for an introduction, and then he will begin his own presentation. But following the presentation, please stick around for a question and answer session. I know that many of you have submitted questions already when you registered for the event, so we want to make sure that we get to as many questions as we possibly can within this very quick hour. But again, thank you all for being with us today. And at this time, I would like to turn things over to Mr. Sherrod Mackey. Sherrod, thank you so much, and take it away.
Hey, thank you so much. I really appreciate it. So good morning, everyone. My name is Sherrod Mackey. I'm the Acting Regional Administrator for the Centers for Medicare and Medicaid Services in the Atlanta Regional Office. I'm joined this morning by my colleagues from our local engagement and administration team, Rhonda Hunter, Kim Buckland, Lana Dennis, and Kim Major. I'd like to first thank Congresswoman Lucy McBath and her team for this opportunity to meet with you all. CMS, the Centers for Medicare and Medicaid Services, has pledged to put patients first in all our programs, Medicaid, Medicare, and health insurance exchanges. To do this, we must empower patients to work with their doctors and make healthcare decisions that are best for them. This means giving you all meaningful information about quality and cost to be active healthcare consumers. On March 13, 2020, a national emergency was declared, and CMS took action nationwide to aggressively respond to COVID-19. We've expanded telehealth in Medicare. You all now have access to broader telehealth services, ensuring access to care while reducing the risk of COVID-19 exposure. We've expanded telehealth to keep you beneficiaries with mild symptoms in your home while increasing access to provider offices. We've expanded the use of virtual care, such as virtual check-ins, which are important tools for keeping you all healthy while helping to contain the community spread of COVID-19. You can now get a broader set of services by telehealth, like a common office visit and preventative health screenings. For example, if you have a visit scheduled related to diabetes management, you can do this via telehealth instead of going into the doctor's office. This applies across the country so that you all living in both rural and urban settings can get care from your home rather than unnecessary travel to a doctor's office. We've expanded the types of services you can receive via telehealth, such as emergency department visits, initial nursing facilities, discharge visits, home visits, critical care visits, radiation treatment management, therapeutic exercise, prosthetic training, assistant technology assessments, group psychotherapy, and end-stage renal disease care. We've expanded Medicare payments for telehealth services to allow you all to have routine office visits for preventative health care screenings, mental health counseling, and care that ordinarily would require you to go into an office. These services can be provided wherever the patient is located, including within your home. CMS is allowing telecommunications technologies to be used instead of in-person services across many settings of care, like home health, nursing homes, and hospice. We now allow various types of healthcare providers to provide telehealth services. This includes rural health clinics, federal qualified health clinics, physical therapists, occupational therapists, and others. Physicians are now able to speak with you all virtually by phone or video rather than in person in order to prevent risk of infection. We have also added payment for services of doctors to treat patients over the telephone. If you have an authorized Medicare Advantage plan, we also allow these programs to allow telehealth coverage to meet your needs. In summary, the main takeaway regarding telehealth services are there is no need for specialized equipment. Your doctor can treat you by telephone or computer. Your doctor can treat you, for example, using FaceTime on your iPhone or Skype video through your mobile phone. Medicare will pay the same amount for these telehealth services to your doctor as if you saw your doctor in person. These telehealth services do not change your out-of-pocket costs. You have the same deductible and co-insurance as you were if you saw your doctor in person. The federal government is allowing your doctor to reduce or waive some of your direct out-of-pocket costs, so please speak with your provider. These telehealth services will be in effect until the public health emergency declaration ends. One other area that CMS is concentrating on is ensuring safety and quality in nursing homes across the country. To protect nursing home residents and employees from COVID-19, CMS has issued a call to action for nursing homes and state and local governments to work together to determine nursing home needs for COVID-19 testing and personal protection equipment. We have a new independent commission to conduct assessments on nursing home responses to COVID-19. We've also issued guidance on limiting visitors and non-essential healthcare personnel at nursing homes for their safety. We have published data showing the rates of COVID-19 in nursing homes, which you all can see information on specific nursing homes on our website. And we've increased penalties for nursing homes with persistent infection control violations. One other area of concern that CMS has addressed is testing and paying for COVID-19 testing. We have made it easy for you all to be tested for COVID-19 without any cost to you. This coverage of COVID-19 tests includes antibody tests. We will even pay for certain COVID-19 tests without a physician order. To ensure availability and timeliness of testing, CMS has allowed healthcare facilities like pharmacies to set up drive-through COVID-19 testing stations. When a COVID-19 vaccine is developed, it will be covered by Medicare Part B with no cost to you. We also are working to increase the healthcare workforce. We've cut red tape so health professionals can practice at the top of their license. Nurse practitioners, physician assistants, and other nurses can temporarily practice at the top of their license and across state lines. They are now able to certify and recertify patient eligibilities for home health care, which would normally have to be approved by a doctor. We're continuing to put patients over paperwork. For example, we're allowing more diabetic patients to monitor their glucose and adjust their insulin doses at home. We're pausing all prior authorizations for durable medical equipment, and we've established a toll-free hotline for doctors to get quick answers on billing and coverage. One other note is that extra days in hospitals can be covered for inpatients who would have been discharged, but with COVID-19, you can stay longer under the quarantine. To help stop the spread of coronavirus, many businesses have temporarily closed. If you recently stopped working or you lost your health coverage through your job or another person's job like your spouse, you may be eligible for a special enrollment period to enroll in Medicare Part B. Please apply online at ssa.gov/Medicare. That link and all of that information will be on the second slide that's up on your screens. Many doctors' offices are reopening or at least preparing to reopen. During the height of the pandemic, many doctors postponed non-emergency, non-COVID care in order to ensure that they have capacity to care for COVID-19 patients in order to preserve supplies such as masks and ventilators. As a patient, the question is, how do you know when it's safe to return to a healthcare facility? And what should you expect when you do it? Ultimately, you and your doctor will come together to make the right decision for you when addressing your healthcare needs. Some recommendations for you to consider while seeking non-emergency treatment. Do not postpone necessary care. Some patients have been delaying care for chest pains, stroke symptoms, and other signs and symptoms of potentially serious health conditions. Do not postpone care that is urgent or may lead to complications such as a heart attack or stroke. Also, do not postpone necessary preventative care such as immunizations or cancer screenings. Do not hesitate to reach out to your doctor if you have any questions about when to seek treatment. Another question we've gotten is it safe to go to the doctor's office or to the hospital? Talk to your doctor about their facilities and the precautions that they have taken to keep you safe. Please consider telehealth or virtual visits. This reduces the risk of transmission of COVID-19. Once you go to your provider, you may be asked to wear a face covering. These face masks limit the risk of getting or spreading disease. Your facility also may ask you to avoid waiting in a crowded waiting area. Sometimes you'll be asked to wait in your car until your visit. Waiting rooms should have chairs that space far apart to keep you and others safe. Please limit the number of visitors or people you go to your appointment with. By limiting the number of people, your exposure becomes limited as well. Try to limit visitors or people who accompany you to your visits to one person. And those visitors should also wear face coverings. Screenings before entering a facility. You and your visitors may have your temperature taken or be asked questions about your health status before entering a doctor's office. This is to keep you and others safe. And please wash your hands often. Use soap and water for 20 seconds or hand sanitizer when washing if not possible. Visitors are advised to monitor themselves 14 days after leaving. Many have the question, should I get tested for COVID-19 before seeking health care? Discuss this with your doctor's office if you should get tested before going. Also, as a reminder to everyone, please be on the lookout for any fraudulent behavior. Scammers may be using COVID-19 pandemic as an opportunity to steal your identity and commit Medicare fraud. In some cases, they may tell you that they'll send you a coronavirus test, they'll send you masks or other items in exchange for your Medicare number or personal information. Please do not fall for this. It is a scam. It's important to always guard your Medicare number and check your Medicare summary notice for any errors. Only give your Medicare number to participating Medicare pharmacists, primary and special care doctors, and people you trust to work with Medicare on your behalf. Remember, Medicare will never call you to verify your Medicare number. It's been an absolute pleasure speaking with you all today. I'm grateful for this opportunity from Representative McBath for arranging this opportunity. The second slide provides you all with resources to assist you with what we've discussed today. I also can be reached by phone at area code 404-562-7902. Again, it's area code 404-562-7902, or by email at Sherard, SHERARD.MCKIE@cms.hhs.gov. Again, it's SHERARD.MCKIE@cms.hhs.gov. And that information will be available to you by that slide as well. If you have any questions, please reach out to me directly. And I thank you for your time today. I know we have a question and answer session, so at this point, I'll turn it over to Caroline.
All right, thank you so much, Mr. Mackey, for that presentation. So we have a few questions that were submitted by some of our constituents. So I will go ahead and start that part. So Mr. Mackey, one of the questions you received, what is the difference between Medicare and the Medicaid program? Has there been any changes in Medicaid eligibility due to the COVID-19 crisis?
Okay. So Medicare is a federal health insurance for people over age 65 or under 65 with a disability regardless of income. It is a national program. Medicaid is a joint state and federal program. It is also a health insurance, however, is based on one's low income and lack of resources and assets. Each state determines its eligibility. I recommend you contacting the Georgia Medicaid office at area code 404-656-4507.
Thank you. Another question, how is this affecting the waivers for individuals receiving a comp or now waiver, or will it be affected in the future?
Sure. These are Medicaid waiver programs. Yes, they have been added flexibilities. And again, I ask that you reach out directly to the Georgia Medicaid office, being that this is administered by the state of Georgia. Again, their number is area code 404-656-4507.
Great. Now, Mr. Mackey, do I need to sign up for Medicare at 65 if I'm still working?
You can delay signing up for Medicare if you continue to work. Take the Part A hospital insurance only and refuse the Part B medical insurance. Part A is free. The only time you would not is if you have a health savings account due to the tax implications. If you do not have a health savings account, sign up for Part A only until you stop working. At that time, you can sign up for Part B without penalty since you've covered through active employment. If you have any questions, please contact the Human Resources Department at your job.
Will retirees receive an increase in Medicare benefits in 2021?
No announcement has been made on that as of yet, but the cost of living adjustment will be released this fall.
My wife is retiring and I'm losing the coverage I had through her employer. What are my options until I'm eligible for Medicare?
The health insurance marketplace is for people who are uninsured. Call this number to get options. It is 1-800-318-2596 for more information. Again, it's 800-318-2596 for the health insurance marketplace.
Do I need to be on Social Security to get Medicare coverage?
No, you do not. Some people get Medicare automatically since they're receiving their Social Security benefits. Others are eligible through SSDI, the Social Security Disability Insurance. There's a 24-month qualifying period. The first 24 months of disability benefit entitlement is the waiting period. You will apply for Medicare coverage through our sister agency, the Social Security Administration.
I have a brother that is totally disabled. He is currently staying in a group home. Is it possible to receive a Medicaid waiver to care for him in my home and get paid as an employee?
So again, with a Medicaid issue in the state of Georgia, we're requesting that you reach out to the state of Georgia's Medicaid office. And since this is a community-based waiver program, we do recommend that. Again, that office number is area code 404-656-4507.
Does Medicare cover hospitalization for patients admitted due to coronavirus? Is there a cost sharing for these services, or has the cost sharing been waived?
Medicare and Medicaid will cover hospitalizations for patients admitted due to COVID-19. Medicare covers all medical necessary hospitalizations. This includes if you're diagnosed with COVID-19 and might otherwise have been discharged from the hospital after an inpatient stay. You will still have to pay for hospital deductibles, co-pays, and co-insurances that apply. If you are on Medicaid, due to the public health emergency, Medicaid is suspending co-payments during this period.
Will Medicare pay for seniors in Georgia to take the Georgia Tech rapid coronavirus test through CVS?
To ensure availability and timeliness of testing, CMS has allowed healthcare facilities like pharmacies to set up COVID-19 testing stations that we will cover.
Can I get a Medicare late enrollment penalty removed?
Actually, yes. Medicare is providing a special enrollment opportunity for people who've missed their chance to enroll in Medicare health and drug plan due to COVID-19. If you disagree with a late enrollment penalty, submit a late enrollment penalty review or reconsideration with a reconsideration request form, or contact your state health insurance program.
How long will telemedicine waivers be available, and do you think any will be made permanently?
The telemedicine waivers will be in place as long as there is a public health emergency. Under Medicare, telehealth has always been a benefit, even once the public health emergency ends. The original public health emergency was declared by the Secretary of HHS on January 31st, 2020. And again, these telemedicine waivers will continue until that declaration ends.
Is there any help for me if I can't afford my Medicare premiums?
CMS is suspending any terminations due to failure to pay premiums due to COVID-19 or the crisis. This will continue at a minimum until September the 30th, 2020. An additional option for those affected and experiencing hardships is to call Social Security and request an installment billing plan. That number to Social Security is 800-772-1213.
Great. Congresswoman, we have a question for you. Do you support the expansion of telemedicine for Medicare and Medicaid beneficiaries?
Thank you for that question. And, I believe that this pandemic has really brought to light the ways that we can leverage technology to make sure that everyone has access to the healthcare that they need. So with the closure of many of our hospitals and our clinics and private practices to, those routine follow-ups, we've seen that telemedicine actually fills the gap for some types of healthcare. I fully am supportive of extending some of the telemedicine waivers that have been put in place during this pandemic. And I think now that telemedicine, I know that it's not going to replace regular doctor visits, and many procedures will continue to still take place within a physical healthcare facility directly with the healthcare provider. I've seen how expanded reimbursement for telemedicine has really just kind of incentivized our doctors to fill gaps in our healthcare system. I myself have actually had one of my visits. It was actually virtually with one of my doctors. So I'm also aware that the costs associated with telemedicine. I'm aware of those costs as well. And while I'm approaching expansion of our services such as this very cautiously, I know that this pandemic has given us some good information on how we can begin implementing expansion of these kinds of services to be better servants to the public. I know that access to healthcare is critical. It's vitally important. And I'm always looking for innovative ways to incorporate technology into expanding options for Medicare and Medicaid beneficiaries. And I will continue to always do that because I recognize that as medicine continues to evolve, most particularly for those individuals that may be in home and are not able to travel, that this is a very, very viable solution for them to be able to get the care that they deserve.
Thank you. And our last question is for you, Congresswoman. If I'm having trouble with enrollment into Medicare, can I contact your office?
Thank you for that question. Absolutely. Please call on our office for assistance. That is why we are here. Helping you with all of your federal casework issues is one of the most important parts of my job. It's one of the most important parts of why we have a district office, and I have a team that are dedicated, very dedicated caseworkers to help all of the residents with your CMS issues every single day. So if you're having trouble with your Medicare benefits or any other federal issues, please contact my office. And that number, if you don't have it, is 470-773-6330. And any member of my team is more than happy to assist you.
Great. So that concludes our Q&A session.
Well, Sherrod, thank you again for lending your expertise to this event and to the constituents of Georgia's 6th Congressional District, and for helping so many people learn about the ways in which CMS is really continuing to serve them during this time. And I'm grateful for all that you do every single day to help the people of Georgia. There again, I do apologize for not being able to see you, not able to see me today, but it was most important that we continue on to make sure that you have all the resources that you need. And for all of you who joined our webinar today, thank you for taking your time to get informed and stay engaged with your Medicare or Medicaid benefits. That's really important that you do so. It's critical that we keep the lines of communication open always, especially during this pandemic. So if we didn't get to your question today, or you find or discover that you have a question, in the days or weeks that come, please contact our office. And as I said, I have a dedicated staff. We're always standing by, ready to help you, help assist you with your Medicare and Medicaid benefits. And once again, I'll give you the office number. If you don't have it, it's 470-773-6330. or you can actually go online and visit us at macbath.house.gov. But before we depart, I want to remind everyone, please continue to stay safe. Please stay healthy. I know that we're watching statistics and percentages of people that are infected with COVID-19 continue to rise across the nation. And please just use everyday prevention to help mitigate the spread of coronavirus. I know these are very difficult times, and I believe, that we're going to emerge from this crisis stronger than ever before. But I do want to thank you all for joining us today, and God bless.
Congresswoman McBath, I just want to add one last thing, if you don't mind.
Please do.
Okay, great. So again, anyone who has any additional questions, please reach out to Congresswoman's office, or you can reach out directly to me at the number I provided earlier. It's 44562-7902. One other thing I did want to mention is that CMS has started a help desk mailbox, and it's been used internally and externally. So any questions you may have around COVID-19 for CMS, please utilize this help desk. It is at COVID-19@cms.hhs.gov. Again, it's COVID-19@cms.hhs.gov. And I also want to make sure, and it's in the slide deck that's up now, a good resource for you all is Georgia Cares in the state of Georgia. They offer assistance, they're unbiased, they don't make recommendation, and they're completely neutral. And it's a great resource to you guys if you have any questions around your care. And their number is area code 866-552-4465, and it's option 4. And that number is on that second slide. And again, it's been an absolute pleasure. Thank you so much, Congresswoman McBath. We really appreciate this opportunity.
You're more than welcome.
And that concludes our webinar for today. Thank you, Mr. Mackey and CMS, for joining us. And all of you, have a great day.